And pharmacies across the Cape Fear reporting a shortage of children's cold and flu medicines. WAY Celeste Smith joins us now live in the studio with more.
Celeste, it's been nearly a month since we first noticed the increased demand leading to empty shelves in stores and pharmacies. What are pharmacists advising parents to do when it comes to finding a solution?
Hi, Jeff and Hannah. I spoke with the Wilmington pharmacist who says there are alternatives for parents looking for over-the-counter medicines for a sick child. The increased demand for children's medicine is due to the recent surge in COVID-19, flu, and RSV cases among children. A spokesperson with the American Academy of Pediatrics says they have steadily seen more cases of all three in children within the last few weeks.
Right now, we're seeing a spike in COVID again, which is very unfortunate. RSV is still around, flu is still around, and we're having kids who come in now with 2 or even 3 different respiratory viruses at the same time, which is something we didn't used to be able to detect, but now we're doing tests that show those things.
Wilmington pharmacist Nick Cipriano says he has noticed the increased demand and shortages of over-the-counter children's medicine and says parents should be mindful when considering substitutes.
With any medication, it's just important that you're treating the right thing, but with colds and flu specifically, medication, the data suggests that using medication won't shorten the duration of your cold or flu, but there's certainly options for symptom treatment.
Go to a different part of the store and get some honey and put it on a spoon. Now, if your child is under 12 months of age, honey can be dangerous. It can cause botulism, so don't do that. Instead, nasal suction, humidity might be helpful for them if they're having a cough or a stuffy nose. Saline is fantastic for noses.
Cipriano is also offering advice to parents who decide to give their children over-the-counter adult medicine.
Each patient is different, just like an adult patient, but for children, there's definitely a recommended dosing depending on age and other factors, of course. So as long as you are well enough informed and have talked to a professional like a pharmacist or your doctor, there are potential options to use.
According to the Consumer Healthcare Products Association, the agency representing major manufacturers of medications like children's Tylenol, Motrin, and Advil, the demand for these products increased by 65% last month alone.